If you're not wearing your glasses or wearing any correction, the light that goes into the eye is not focusing, it's scattering. So it's almost like somebody's bringing a big bright flashlight in front of you, especially for patients who are driving at night. Patients where they're driving and they're like, these people with their headlights.
Happens to me all the time.
Yeah, it can really disturb you, and it can cause a lot of, it can cause accidents because it can really disturb you when you're driving. That all has to do with
eyes open, hearts ready. Welcome to Wellness Deconstructed. I am Zia Jaffer, and together we're stepping into the arena of authentic well-being. Myth-busting, truth-seeking, and definitely life-changing. Break free, live boldly. It's time for a conscious uprising.
Hello and welcome back to Wellness Deconstructed. Today, our guest is Dr. Sophia Asaria Banji, who is a distinguished doctor of optometry and a respected fellow of the American Academy of Optometry. With over 12 years of experience as a Keratoconus eye specialist in Mombasa, she has dedicated her career to providing exceptional eye care services to her patients and raising awareness within her practice and the broader community. Her commitment to advancing eye care and her compassionate approach to patient care have established her as a trusted figure in the field of optometry. Welcome, Sophia.
Thank you. Thank you for having me.
It's a pleasure. You're the first doctor on my, no, actually, Dr. Ruchi was there as well. But in this season, you're the first doctor, and I picked you because you're like the best doctor I've been to. Best eye doctor. Like, I feel like I've been for like so many eye tests and stuff, but nobody checked me as thoroughly as you did, right? So I want to create awareness about eye care. And I felt like you're the perfect one for it. So let's get right into it, right? What is keratoconus? Like, I could hardly even say it.
So keratoconus is actually a disease of the cornea. Okay. The cornea is the front curvature of the eye. It's a very, very thin layer that is actually clear. So what keratoconus is when that thin layer becomes very weak. So if you were to look at a layer, the front layer, when it becomes weak, it kind of has gaps. Okay, when you have gaps like that, essentially the cornea can then bulge out like a cone outwards from the eye. Hence the name keratoconus. And what happens with keratoconus is, unfortunately, those patients have slow, progressive vision loss, and glasses, unfortunately, cannot provide the best care. We have to look at other options in terms of contact lenses or specialty contact lenses like scleral lenses or RGP lenses. But those patients are very... Actually, it's underdiagnosed. It's a disease that, unfortunately, the awareness is not out there. Previously, it was saying 1 in 2,000 patients had it, but actually, it's about 1 in 334 patients who have keratoconus. So it's definitely an underdiagnosed disease.
So it's like the degeneration of that layer?
Correct. Yeah.
Wow. So I think maybe my grandmother had that. Like, she over the years, as she grew older and older, she kept losing vision slowly at a time. And I don't know what the word in English is, but in India, they always said that the curtain of her eye is fading. Okay. And then eventually she grew blind completely.
So it sounds more like she might be experiencing cataracts. Cataracts is when the lens inside the eye slowly starts to degrade. And essentially what happens, it kind of becomes milky and brown. Okay, and then the vision just kind of disappears completely. However, there's treatment options to actually remove that lens and put a new lens in place. So we have treatment options to actually now improve people's vision, especially as you get older. It's definitely something that should be evaluated. And there's treatments out there, so there's no reason, nobody should be blind. Everybody should be enjoying their life until their last days.
Yeah, for sure. So how can people find out if they have this condition or any other condition?
So what's really important is just to go to an eye care professional. There are certain tests that need to be done. Obviously, a scanning of the cornea. There are some measurements that need to be taken, and this is something that should be routine care. That's something I've really advocated for, especially in Mombasa and Kenya. It's something that is so underdiagnosed that people, unfortunately, are not able to no one's really catching it as quickly as they should, because it really starts at a young age in terms of keratoconus. So our young kids, especially the ones who are rubbing their eyes, I was previously talking about allergic conjunctivitis, which is a disease where you have lots of irritation of the eye, and that's caused by the environmental changes in terms of dust and irritants. And if you've got kids who rub their eyes, who unfortunately, kids don't know that rubbing the eyes is a bad thing, right?
Yeah.
So when you rub your eyes, you essentially weaken the cornea, and that then can lead to keratoconus. So that's why it's an underdiagnosed.
So how early do you think we need to go to an eye test, like a thorough one?
Yeah. So in terms of kids, every kid essentially from about 6 months old and older should have an eye exam at least once a year, up until they're about 18. And then from there, you can kind of space it out and have an exam every 2 years. And essentially, if you are being followed and someone's actually evaluating the eye completely, they will be able to catch these small changes.
Okay. And so how are your tests different from other normal tests that we go to, like the normal opticians and do, right, for our lenses?
Right. So in terms of optometry, what we actually do is we don't just check for lenses. We don't just check, okay, do you have numbers? And when we talk about numbers, we talk about refractive error. Refractive error like myopia, astigmatism, presbyopia, or hyperopia. So what we actually do is we start from the beginning. We obviously do check to see if you need lenses, but then we also do take a look at the front health of the eye. So we look at the cornea, we look at the white part of the eye, and we also look inside as well at the back of the eye. So we're actually talking about a comprehensive eye exam. So from the front of the eye all the way to the back of the eye. So we try and take a look and check everything from essentially the front to the back. And that's a comprehensive examination. That's something where you can pick up any minor changes or any concerns. We can actually evaluate that.
Yeah, I love that. And I feel like now I know why your eye test was different from the other ones that I've been through, because you took me through, I mean, you still continue to take me through that process every time I come to you, right? And you can immediately catch on my eye dryness and the scratches in my eyes since I started wearing lenses. So is that something that you see most commonly amongst patients?
I see a lot of dry eyes. You know, dry eyes, unfortunately, is something that's so common, especially because we're using screens more. You know, our screens are something we can't get away from. Our kids are using them. You know, we're using them every day, and it's not just an hour or two, it's a consistent thing. So dryness is definitely a huge concern, and it's something that I treat every day.
So what do you think is the remedy, like a home remedy for dryness in your eyes?
So actually there is a recommendation from the American Academy of Ophthalmology, and they actually say there's a rule. It's the 20-20-20 rule. So after using a device for 20 minutes, take a 20-second break by looking 20 feet away. So what does that really do? Okay, it's hard to not obviously use our devices for longer, but if you can take these small breaks after 20 minutes, a 20-second break it's not much at all, right?
For sure.
It's not much at all. So if you do that and you look far away, essentially what you're going to do is your blink rate is actually going to improve, okay? Your focusing system in the eye, which is our accommodation, relaxes. So it's targeting a few things. So what it's actually going to do is going to help the blink rate by you looking far away from a screen, because you will actually now start to blink normally. When we use screens, our blink rate reduces by 66%. So that just means our eyes blinking. When we blink, our tears refresh over the eyes. So when you stare at a screen, you're not blinking. And essentially the tears are just kind of getting irritated. You're not getting that refreshment like you need to. So following the 20-20-20 rule is something we can do. We can definitely adopt it. It's definitely something that's easy. And our kids should also be aware of this because we're using screens as well, right? And that's something very easy to implement on our day-to-day. So don't forget 20-20-20.
So thank you for sharing that. I know that that relates to how our nervous system can also regulate, because when us or our kids are focused on their screen, their nervous system gets dysregulated and goes into sympathetic mode. So when they look away, they're also recommended to like look far, look on the side, so that their eyes can look around, and also that helps their brain understand the actual place that they're in and ground back again to reality and move their nervous system to parasympathetic. Because I feel like when you just take the iPad away from them or the screen away from them, they literally like burst out into a tantrum because they've like literally gone numb into the freeze state and they don't know how to function, right? So helping them do that exercise not only helps them with their eyes, but also regulate their nervous system and bring them back into balance. So thank you for sharing that. So how do people know that they have dry eyes if they haven't come to you?
Yeah, so that's a great question. In terms of dry eyes, what you can actually be experiencing is, first of all, you can experience blurriness in vision, okay? You might feel like you need to blink to kind of clear the vision up. Yeah. You can get itching, irritation. The burning is usually something that happens towards either the mornings or the evenings, because towards the end of the day, that's when the eyes become most dry. So that's where you're gonna feel irritation, and also lots of fatigue. Headaches, fatigue of the eyes, just a heaviness overall. Those are all signs of dryness.
So anything that we can do for that? Like if I'm feeling, because I realize I have been feeling like my eyes are burning at the end of the day because of wearing lenses. I know that you recommend some
lubricants. Absolutely,
lubricants.
Yes. Lubricants are definitely one way to tackle, and it's almost going to be an instant relief that you can get. Lubrication is something you can do throughout your day. It's definitely advised if you're going to be on a screen for longer than a few hours a day, definitely to consider lubricating. And then the 20-20 rule, that's also something you're going to implement as well. And in terms of dryness as well, getting enough sleep and hydrating. We forget to hydrate, and we don't realize how much that does not just affects, there we go, doesn't just affect our eyes, that's the rest of our body as well. So hydration is a big one, and getting enough sleep. You don't realize, especially for kids, 9 hours of sleep is something that's recommended for them. That's just in terms of eye care for them, in terms of growth of the eyes. If a kid gets enough sleep, the chances of them getting myopia are reduced significantly.
So what is myopia?
So myopia is essentially a refractive error. That means that you struggle to see things at distance.
Oh, okay.
So what happens is when you're growing, the eyeball, if it grows too much, essentially the light cannot focus into the eye on the retina. So it actually focuses at a different point. And this is when you need to start wearing glasses. So if you have myopia, unfortunately, it's something that you can't get out of because your eye is already larger than normal. So for kids in particular, this is essentially, it's an epidemic is really what it is. They're saying in 2050, 50% of the population will have myopia. Wow. So this is actually something we can do for our kids, and getting our kids checked early. We can actually slow the growth of their eye and slow the growth of myopia with different therapies and treatments.
But this is like, is it something that they're born with, or is it like a growth?
Yeah. So essentially, it's essentially when we're using more screens, what happens is we're triggering our eyes to grow. Okay, and our young kids are using our devices all the time now, right? So when let's say, for example, if you were younger, you might have been reading a book at night, or using devices, definitely, right? Yeah. And that's what causes the eye to grow, and it makes the eye continue to grow.
Okay, so that's what gets you numbers. Like that's what it is.
Oh, that's exactly
okay.
Right.
Yeah, so that was going to be my next question. Like, what about vision in kids, right? Like, and I feel like it's getting worse by the day because of excessive screen time, and it's leading to more of this myopia. And in simple words, just glasses.
Needing glasses to see at distance.
Yeah. That's exactly. So what are the different ways we can avoid that, other than, of course, reducing screen time and looking away?
Yeah. So a couple of things that you can do is, first of all, to have your kids checked regularly. If you can check your kids regularly and you start to see the onset of myopia, there are certain things that we can do to slow myopia. Okay. Obviously, getting rid of screens, that's number one. Okay, you can't get rid of it, but manage it accordingly.
Sorry, I'm going to stop you. Does distance, the distance of your eye from the screen matter as well?
Absolutely. Yeah. So they actually recommend, if you can have your screen essentially like elbows length away, that's really where you need to be. Of course, screens, they keep getting closer and closer and closer. And the closer they get, the more the eyes are essentially triggered. Yeah. And, that strain is what happens. And the eyeball starts to grow from there.
Very interesting. So at an arm's length, and then the 20-20-20 rule.
Exactly.
Like the tricks to go, right? To start off with. But what about the effect of sunlight on not just the kid's eye, but also the adult's eyes? Yeah.
So let's talk about the kids first.
Yes.
They actually say if a kid spends 18 minutes or more outdoors daily, their risk of myopia can reduce by 50%. That's 80 minutes. So imagine that They just need 80 minutes outdoor. They're saying it might have to do with sunlight or just, the focusing of our eyes kind of focusing and looking at things at distance. So that's for kids and adults as well. Let's face it, when you're outdoors, you're also getting that vitamin D. That is something that, we thrive off of. And that's a vitamin that we really need just to kind of give us an overall wellness. Yeah, so being outdoors, spending a bit more time outdoors as opposed to being in front of our screens. It's going to help everyone.
Definitely. Oh, yeah. So my question was, how does that affect the eye?
Like growth of the eye.
Excessive exposure to sun.
Yeah, so it's a great question because there's kind of a very important dynamic. Yeah. It's great for kids to be outdoors, but also important to protect our eyes from the sun.
Yes.
Because sun exposure is something that can cause a lot of issues. Yeah. The first thing I think of is cataracts. Okay, cataracts are going to be something if we're lucky enough and have enough birthdays. As we get older, we will all get cataracts. Okay, and that's just because the lens in the eye gets enough UV light in it, and then obviously the lens starts to become a bit cloudy. Remember we were talking about your grandma that had possibly had that. Now, protecting your eyes for the sun is so important because it does a few things. It protects your eyes so your cataracts don't grow too quickly. Okay. Also protects your retina, which is the back of the eye, because that UV light constantly going in is not good for that.
Okay.
But in terms of the front part of the eye, when you have exposure to excessive sunlight, it can actually cause irritation to the front part of the eye. The white part of the eye, you can actually get these tiny little blisters. You could call them sun blisters. They're called pinguiculas. And they're these little blisters that can start to form just on the eye, and these growths can just get bigger and bigger and bigger. And that's because of excessive UV exposure to sunlight. So there's quite a lot that can happen if you have too much exposure to sunlight, but important to protect your eyes.
So when I go out, my eyes always squint and I get a headache if I go without sunglasses. So what do you think is the cause of that?
So it can be a few things. First, it can be uncorrected refractive error. It could be that the light that's focusing into the eye is being scattered. So that means we might need to look at the correction that you're using. That's number one.
No, but what if I don't have any correction on?
If you're not wearing any correction?
Like I have nothing, no lenses, no glasses, no sunglasses. And I go out and it just feels like it's just way too much light for my eyes and I start squinting. And then it's like, if it is more than 10 minutes, like if I'm in there, then it just like starts giving me a headache.
Yeah. Could be dryness. That could be a really big one. Dryness is number one. Second thing is the uncorrected refractive error. If you're not wearing your glasses or wearing any correction, the light that goes into the eye is not focusing. It's scattering. So it's almost like somebody's bringing a big bright flashlight in front of you, especially for patients who are driving at night. Patients where they're driving and they're like, these people with their headlights.
Happens to me all the time.
Yeah. It can really disturb you, and it can cause a lot of, it can cause accidents because it can really disturb you when you're driving. That all has to do with dryness or has to do with the light not focusing into the eye. So checking your refractive error is going to be a really important one to be mindful of.
But do you think that happens even if you are wearing your lenses or
glasses? Yes. Yeah, it can definitely happen. Dryness is a big one. Tears, essentially our tears are like the windshield of our eyes, if you think about it like that. So if your tears are not refreshing over the eyes and the tears are not healthy, then you will definitely get more photophobia, which is light sensitivity.
Yeah, and it reminds me, like I know when I hardly drive at night because I feel like I'm blind and I can't focus. Like the light just blinds me when it's coming from the front. But you're right. Like I have to like blink for a few times and then I'll be like, okay, maybe I can see better now. So what are the different ways that, like we talked about excessive sun exposure, right? Like what are the different ways we can take care of our kids' eyes from a young age from excessive sun exposure? Especially people or like kids living in Mombasa, I feel like they get a lot more exposure to sun than kids living in Nairobi or in colder weathers. How can we take better care of their eyes now at a young age so that it doesn't get worse later? And then we can move to the adults.
Yeah, so in terms of kids, really important. This also goes for adults as well.
Okay.
Sunglasses. UV protected sunglasses. Okay, UVA, UVB light. Sunglasses are going to be so important to not only help with the light, but to obviously protect the eyes. Even not just from the sunlight, but even the irritants, the dust, the things floating around. If they wear sunglasses, they're protecting themselves from that. Wearing a hat, Okay, hat's going to be really important. That's obviously going to protect the sunlight from getting into the eyes as well. So those are I would say are going to be the two most important things that you can, very easy. Anybody can do that, you know.
Yeah.
Sunglasses, if you start wearing sunglasses, your kids will also do the same as well.
Yeah.
Hey, mama, I need sunglasses too.
Yeah.
You have them. Can I have them too?
Yeah.
And it's a really important part, you know, of our lifestyle that we can do and show our kids. The importance of that, and protecting obviously even our skin, right? You know, when you wear a hat or you wear sunglasses, you're protecting yourself, and even wearing sunscreen.
Yeah.
Let's say sunscreen is a big one.
Yeah.
And where we're exposed to so much more UV than in other parts of the world, especially in Nairobi. You won't get as much sun. We get a lot more sun in Mombasa. So it's something that we have to be extra mindful of.
And what about, it reminded me, like the exposure of sun and being in Mombasa reminded me like how kids spend a lot of time in the pool. So what do you think, like the chlorine also affects them?
Absolutely. And what's really important is to consider wearing some goggles when you're swimming. Chlorine, it's a chemical. So when that gets into the eye, can cause irritation. You know, our young kiddos that come to me, our swimmers, constant irritation of the eye, swelling. So what you can do is you can actually lubricate the eyes after. So once the kid is done swimming, lubricate the eyes. That just essentially rinses and cleans the eye. So if there's any chemicals or chlorine getting to the eyes, you can actually just rinse it. It's also something to be very mindful of, because if you're constantly exposed to that chlorine, that can cause degradation of the eye and of the cornea and the external surfaces. So lubrication is going to be really important. And goggles, protect your eyes as much as you can. I know it's not easy. Sometimes it's not easy to do that, but if you kind of get into a flow, hey, if we're going to go to the pool, what do we need? Goggles and our lubricants. That's going to be very important to consider.
And thank you for sharing that. That moves me to like a question for adults, especially for women. Like, how do you think like our eye makeup affects our eyes?
It affects our eyes a lot. The makeup that we're using, and we're using it on a day-to-day basis, it's so close to the eye, and the skin around the eye is actually some of the thinnest skin that you have. So when we use eye makeup, we have to be very, very mindful of what's getting into our eyes. So when we use eyeliner on our lash line, that can cause irritation in terms of bacteria. Your makeup has to make sure you replace it frequently. Try not to share makeup as well, because that can cause a lot of issues and infections of the eyelids. You'll get some patients with chalazions or the styes, and that has to do with, first of all, getting bacteria to the eye. So whether it's using makeup, whether it's rubbing your eye with your fingertips, that bacteria then goes to the eyes and can cause infections and irritation. And so it's just really important when we talk about makeup, especially around the eyes. We have to be mindful of that. I get it. We can't get away from it. I mean, you know, it's part of who we are and what we do, but we can be a bit more mindful of how we're using it and applying it, and just to make sure that you're replacing it frequently.
And also like when taking it off, like especially if you have the kajal or the liner inside the lash line, taking it off is like a whole another task. And I feel like sometimes I'm like harsh on my eye to like make sure that it all comes out, but then it leads to my eye burning afterwards, you know, because you're using micellar water or something, or even oil, and it goes into the eye very easily because you're trying to like get
all the makeup off.
And that makes me think like, I don't know how this is hurting my eye, but it definitely is, right?
Of course. And especially, you know, when you get those chemicals into the eyes, that obviously can trigger your tears. You'll have a lot more tears and irregularity of the tear film. And that can just cause redness. And the biggest one is, you know, when you apply makeup on the lash line, there's glands along those lash line called meibomian glands. Now, those glands naturally secrete oils into the tear film. So if you think about the tear film, there's actually 3 layers. The top layer is the oil layer, the middle layer is a water layer, and the bottom layer is a mucus layer. That's the layer closest to your eyeball. So when we talk about the meibomian glands, if you apply makeup there, that makeup can go into the glands and block them. That means your natural oils are not coming out into your tear film, and that causes instability of vision, blurriness, dryness, and can also cause infection if you get infections or any sort of bacteria into those glands. So there, you're right. This is a great question. There's a lot involved in terms of our eyes, and especially makeup when we're using makeup on the eyes. So we have to be very gentle.
For sure.
Really important to be gentle on the eyes.
And I remember you telling me to put like a hot compress on the eye. Was that for that?
Correct. Yeah.
So that helps like unblock the pores, or unblock the glands and help secrete the oils back to.
That's exactly right.
To its correct balance, right? And when you talked about the eyelids, I know that when I came to you, also checked my eyelids. So what was the reason for that?
It's just part of the routine exam. We always check eyelids because you can actually help meibomian gland dysfunction. You can help it before it becomes bad. Even dry eyes. A lot of patients don't know they have dry eyes, but we can actually test to see what's the extent of your dryness, how are your glands, how are your overall tears, and that's just part of a routine examination.
So even the eyelids have glands, right, that you assess.
Correct, yeah.
Regarding their production of oil or whatever that is.
Exactly.
So thank you for sharing that. It's really interesting, and I feel like so helpful for women that are putting makeup all the time, and we deal with dryness and we think it's just screen, but it could be so much more than that, right? So in your work experience, or having been in Mombasa for all these years and worked here, are there like any specific diseases that you have seen on the rise or seen commonly in this part of the world?
Yes, absolutely. When we talk about a comprehensive examination, we actually look at the back of the eye on the retina. Now, when we're looking at the retina, we can actually catch different diseases before they manifest in other places in the body, because the vessels in the eye are some of the smallest in the body. So we can see things like diabetes, blood pressure, cholesterol. We can see that in the eye.
Wow.
And diabetes is one of those diseases that is on the rise. Our diets are changing, especially obviously even here in Kenya and across the world. Our diets are changing, and we're taking in a lot more sugar than we should. And that's essentially leading to diabetes. And diabetes can cause a lot of changes in the eye. We can have fluids essentially leaking in the back of the eye and changing the vision. So diabetic patient can come in, and if their sugar is high, their vision's going to be different. If their sugar is normal, their vision's going to be different. So that's why it's really, really important to be mindful and to get a comprehensive examination so we can check these things and we can actually detect these diseases, without having obviously checking our blood sugar. We can see what's happening in the eye.
So even our diet affects how our eyes function, right? Or malfunction.
Yes.
As a result of bad diet. And what about, so when we went to Samburu, we realized that a lot of old people have like a ring around their eyeball. And we were told that that's because they have a lot of locally made alcohol, which is not tested for the amount of ethanol that they have, that the alcohol consists. Is that something?
Yeah, so essentially that ring around the eye, what I'm thinking is what you're saying, it's called arcus. It's more of a older diagnosis, or diagnosis in older patients. Okay. And it's like a kind of a blue ring, kind of makes their eyes look a bit.
And some have thicker, some have a little thinner.
Yeah, and that's actually a cholesterol deposit that's there. So those patients, you also have to be mindful of their cholesterol, but that's something that happens in older patients.
So it's not alcohol related?
Not necessarily.
Oh, okay.
But really important when we do talk about alcohol, that can actually cause toxicity to the retina. We've had patients who've had that drink, that changa drink, the locally made stuff, and they have actually just gone blind from it. Yeah. Toxicity to the retina is a real thing. So you have to be very mindful of, what you're taking in terms of your diet and what you're drinking as well.
And so it's really interesting how the basic advice that we give people for their well-being, like hydrate yourself, avoid toxic chemicals, but also like toxic food, right? Like too much sugar is toxic for you and can lead to diabetes, not only in your body, but then it's also going to affect your eyes. And I feel like eyesight is something that is so important for us in our lives. And seeing my grandmother like deteriorate by the day, like made me realize like, okay, this is something I really need to take care of, but it's not talked about at all. And it's really interesting to see that how the wellness of our eyes is linked to how we eat, how we live our life, how we operate on a daily basis, like wearing sunglasses or wearing hats. Is just not to protect our skin, but also our eyes. Yeah, thank you for that. It's a great reflection that I just had. So my last question would be, have you seen any other diseases that have crept up? Like, I know you talked about diabetes, but any other ones that we should be aware of that are more common in this side of the world than anywhere else?
It's really interesting you say that, because remember we talked about keratoconus.
Yeah.
There's a huge prevalence of keratoconus that goes undiagnosed. And I've noticed here, being in Kenya, being around a more dusty environment, a lot of our kids come in with a conjunctivitis, allergic conjunctivitis, and they'll just come in rubbing their eyes and not realizing that there is actually a disease that can be caused by that constant rubbing of the cornea and of the eyes. And so I see a lot more of that, quite a bit of it actually, and that's so underdiagnosed. Because patients will just go and unfortunately go to a chemist and just grab any eye drop. And then they don't realize also the eye drops that they're using, and if they use them long term, for example, if you have an eye drop that has a steroid, that can cause long-term issues on the eyes. It can cause early cataracts. It can cause all sorts of irritation inside the eye. And so I think there's not enough awareness around what eye drops we use or what we can pick up from the chemist. And so that's something to be mindful in terms of educating patients, to be mindful of what are you putting on your eyes. Please go see an eye care professional. Make sure it's diagnosed. Make sure that something is being treated. What you're getting is what you need. Okay. Yeah. And the excessive use of antibiotics, it's a really big, it's also an epidemic as well.
Yeah. I'm really glad you brought that up, because antibiotics can do a lot more harm than good if not taken correctly, right? Absolutely. And I feel like your system can get immune to it if you just take it without prescription, and I've seen that on the rise. I have friends that just go to the pharmacy and just pick up antibiotics saying, okay, my child is sick, give me this, because it's not regulated enough here, right? Also, do you think the rise of the disease, like you said, keratoconus, is because we're living in a developing country where there's like construction on the rise all the time, and there's more of that toxic material like cement and all limestone and all these things that are coming at
Absolutely. Yes. I think it makes a huge difference in terms of what is our environment bringing us. So there's definitely
it contributes to it.
It really
right?
does. Yeah. Your environment contributes to so much of your overall health. Yeah. So yeah, I would definitely say that it's a very important point you brought up. But yes.
Thanks for sharing. Okay, I have one last question. Like the deposit that we get in the inside of our eyes when we wake up, why is it like, what is that? But also, why is it sometimes more than the other times?
Great question. So what that is actually it's almost like, when you have tears, our tears naturally rinse and clean the eyes, right? Sometimes there's debris that gets in the eye, right? So essentially what can happen is that can kind of create a buildup. Okay, overnight, because overnight your eyes are not blinking, right? Your tears are not refreshing, the eyes are closed, and so you're basically getting a bit of that buildup that's there. What's really important is to not dig around and remove it. Removing it very slightly is great, but try not to dig around in the eye. They call it fishing. We don't want you to constantly be pulling that out, because that can actually lead to more irritation of the eye and more production of that. So that's most likely just discharge that's coming from just eyes that just need to be a bit more clean or lubricated. But there is also discharge you can get from having an infection. So if the discharge is sticky and white or green, then that's most likely an infection.
Okay. So I guess like your eye gets like time to recover and balance the hydration levels, and that's why like it just collects all the chafu on one side, and that's why you're like and when you clean your eyes in the morning, it just goes away, right?
Exactly.
Generally it just goes away with a wash.
It does.
Yeah, thank you, that was really good. I feel like there was a lot of information that we needed in relation to our eyes, and I feel like even in the wellness industry, we don't talk about eye health at all. Like we talk about our physical health, body, muscles, everything, emotions. But I feel like every organ in our body needs to be taken care of, and eyes are the ones that are the least talked about. So I think this was a really great conversation and really needed. Thank you.
I'm happy to be able to share.
It's a pleasure. So before we close, you know about the rapid fire round by now, I'm sure, that I do at the end with every guest.
Yes.
So just a few questions and then we're done. Okay. What's 2020 vision? Is it real?
Yeah, that's a great question. 2020 is essentially just it's a numeric value that we put on, how do I explain this? At a particular size of a letter at a certain distance, we call it 2020. So it's like 20 feet, the letter has to be a certain size. And we essentially, that's kind of like our standard. It's where we can start measuring vision from. So yes, 2020 it's just a numeric value. It's just a standard. It's the size of a letter that's at 20 feet away.
So it's not like optimal vision, is it?
So patients can come and actually have better than 20/20 vision, 20/15, 20/10. It's just the best standard or the most common standard of vision. Yeah, it's a great question though.
What's the most bizarre eye concern you've dealt with?
That's a great one too. So I actually had a patient who came in and he, was handling tomatoes, and he actually got tomato larvae in his eyes. So when he came in and I looked at him, he's like, there's something crawling in my eye. And in fact, when I looked at his and I was doing a slit lamp examination, there were little larvae going around on his eyes, swimming around. Yeah, it was a very interesting case. I have pictures and videos of it, and it's just quite a great reminder where we're living and what people are exposed to.
Yeah.
So that was quite an interesting case.
That is bizarre.
So you actually have to remove these tiny larvae, and there wasn't just one. I mean, it was like over 20 in each eye.
And they might have grown over time, right?
Absolutely.
Would you have 20/20 vision or be able to see in the dark?
For me, I would love to be able to see in the dark. I think there would be a different world. It's almost like when you go scuba diving, you're underwater. It's a different world. So I would actually prefer to be able to see in the dark.
What's the most surprising thing you've learned about the human eye?
The most surprising thing, how resilient it is. I've had patients who have come in to the point where we're almost like, we're not sure if this patient's going to regain vision. And it's just an incredible organ that we don't appreciate enough. And it's just so resilient. And even if you've got a patient who only has one eye, it's the amount of sensory that patient can get from just having one eye. So I think there's a lot of, we neglect our eyes and we don't appreciate them. So yeah, I would say it's quite resilient.
If you weren't an optometrist, what do you think you'd be doing?
That's a really tough one.
Did you always know you wanted to do optometry?
No, but I knew I wanted to be in touch with people and help them grow. I think, optometry is something that just kind of I fell into. And it's pretty incredible, to be able to help someone see. Because without our sight, it's such a fulfilling profession to be able to be part of that. And I have patients who come to me and they're like, my mom almost lost her eyes and you saved them. You don't realize, that importance. And so that's a hard question. I don't know what I would do. It'd be helping people in one way or another and educating them. But yeah, so it just happened to be eye care is what fell into my lap.
Nice. I think you've already given us this. What are some screen time tips you can give? It was the 20/20/21, right?
There's also another one I can give. When you are using screen's really important to remember, obviously, to keep things arm's distance away. Also in terms of glare, when you've got a screen and let's say you have a light that's behind it, that can cause a lot of glare and that can cause extra sensitivity to the eye. So make sure if you're going to be using a screen, either lower essentially the brightness, lower it down a bit, and just make sure there's no glare. There's no light from behind, because that can really cause the contrast sensitivity to be a bit harder for you to experience. And
that reminds me of another question. I'm going to break this a bit. What about looking at your screen in the dark?
Yeah. So if you look at your screen in the dark, it's first of all, it can do a few things to you. It can kind of change your circadian rhythm. And that's why people who use screens at night, their sleep pattern does change and they get disrupted. So you can use a screen, but reduce the brightness. Try and reduce the brightness. That's going to be the best thing you can do if you need to be using your screen at night.
Or what about like turning on the light?
Turning on the light is even better.
Better, right? Like,
it's better.
I mean, I know if there's kids, you can't really do that.
Of course.
But if kids are doing that, you can tell them like rather go and sit in a brighter environment so the contrast is not that much.
Absolutely.
Because I feel like looking at your screen in the dark, like, I don't know, it just like makes your eye tear more and like.
Yeah. And that's the dryness when we talk about tearing. It's actually the dryness that it's causing because that blink rate is what reduces.
Thanks for sharing that. What are early warning signs of eye problems that everyone should be aware of?
Redness, irritation, headaches, fatigue. That's going to end obviously having blurry vision, struggling to read, struggling to see at distance. That's why just a routine examination can literally help with all of that. You can catch things early. But yeah, burning, itching, redness, and obviously blurry vision.
Awesome. What's one thing someone can do to improve their eye health?
I would say being aware of your screen time, because dryness is a really big, it's just a huge factor in terms of our eye health. It causes the blurriness, the irritation of the eyes, and that's a big one. When you can't see well and the overall heaviness and headaches can start to, really affect you overall. People can't work sometimes. It becomes a detriment to their livelihood and to their happiness. So I would say being mindful of screen time.
Any food or supplements that can improve eyesight?
Yeah, in fact, eating green leafy vegetables is great for the retina. You can also consider your omega-3s, eating your fishes, obviously with the samfish oil is fantastic for the eyes. Also really good for the tears as well. So I would say to consider, they say carrots. Vegetables are fantastic. There's nothing wrong. It's great to have vegetables, green leafy vegetables for the retina, and then to consider your fishes and your oils, your fish oils for the front surface of the eye.
Great. What's the most important thing you want people to know about keratoconus?
It's so underdiagnosed and it can really affect a patient. But the most important thing someone should know about keratoconus is there's treatment options. You don't have to live with that. There are things that can be done. There are procedures that can be done. There's lenses that can be used. I'll have patients who come in and they're like, I've been living with this disease for 20 years in my life. I can't work. I feel so disabled. But there's actually a solution. It's important for you to go to the right care provider who can then tell you, what the treatment options are. So there's hope, especially for patients with keratoconus. Even if it's a progressive disease, there's a lot of options out there. So I think that's a really important note everybody should be aware of, especially about keratoconus.
Thanks. Any last piece of advice that you'd like to leave for who's watching this?
Just make sure you get your eyes regularly checked. That's key. We unfortunately can sometimes put it on the back burner, but eye health is something that don't forget about it. Just having a routine examination by someone who can do a comprehensive exam is going to be vital to your livelihood and your wellness.
Yeah, definitely. Thank you. Thank you for sharing and contributing to our podcast. As a token of appreciation, we have a little present for you.
Thank you. Thank you so much.
Thanks for being here and contributing.
I'm so happy to be here. Thank you for having me here.
It's a pleasure. Thank you for watching yet another episode of Wellness Deconstructed. I hope you can take care of your eyes now and not neglect them because eyesight is really, really important for you. A big, big thank you to our gift sponsors for this season, Oyana, Green Thing Kenya, and Jars of Goodness. Your support in our vision means everything to us. Remember, like, comment, share, and subscribe because your support means everything to us. And until next time, keep prioritizing your well-being.